Not every cough needs panic, but some definitely need attention. Parents often ask me, Doctor, my child is coughing. Do I need to worry? Let's make this simple. You can relax if your child is active and playful, eating reasonably well, there is no breathing difficulty, the cough is mild and decreasing in 5 to 7 days. Now, most viral coughs behave like this. But please seek medical help if you notice your child is having fast or difficult breathing, there is chest retractions or noisy breathing, fever lasting more than 3 days, the cough is lasting more than 2 weeks. If the child is dull, sleepy, or refusing feeds, if there are bluish lips or severe coughing fits, and one more thing, if the infant is less than 3 months, there is history of asthma or allergy, if there is cough following a choking episode of foreign body suspicion, do check early. So trust your instincts.